Welcome to the South Asian Public Health Spotlight Association Spotlight Series, the platform where we spotlight the remarkable journeys and career trajectories of trailblazers in public health, with a special emphasis on the South Asian community. We're your host, Amish, Partnerships Coordinator for the South Asian Public Health Association, or SAPHA, and
Anita Balan, member of the Event Planning and Professional Development Committee for SAPHA. SAPHA is an organization dedicated to advancing the health and well-being of South Asians in the US and the communities in which they live, and has been instrumental in fostering collaboration, advocacy, and research to address health disparities and promote equitable health outcomes. Today marks a special occasion as we kick off a series of interviews commemorating the 25th anniversary of SAPHA. As your hosts, we're thrilled to delve into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAPHA over the past 25 years. Learn more about us and explore the wealth of resources we offer at www.sapha.org.
Thank you, Anita. Today's episode features one of the inaugural board members of SAPHA, Dr. Amita Vyas, a distinguished leader in public health and academia, as a tenured professor at the George Washington University School of Public Health, director for the Masters in Public Health Maternal Child Health program, and the visionary behind the Center of Excellence in Maternal and Child Health. Dr. Vyas has dedicated her career to addressing the most pressing issues facing women, children, families worldwide. Beyond academia, Dr. Vyas is a catalyst for change on the global stage, serving as editor-in-chief of Women's Health Issues, founder of the Global India Fund, and an executive member of the State Department's U.S.-India Alliance for Women's Economic Empowerment. Her impact resonates far and wide, touching the lives of countless individuals and communities. We are honored to have Dr. Vyas with us today, a true champion for women, children, and families, whose unwavering dedication continues to shape the landscape of public health and social justice. Dr. Vyas, welcome to the SAPHA Spotlight Series. Before we dive into SAPHA's journey, let's start with a glimpse into your own path in the field of public health. So our first question is, can you take us on a brief journey through your career in public health and illuminate how your path led to the inception of SAPHA?
Thank you. Thank you, Amish. Thank you, Anita. It is so wonderful to be here with all of you, and it's incredible to hear you say the words 25th anniversary of SAPHA. So a big hello to the entire SAPHA community as well. So my journey into public health started many, many years ago, decades ago, actually, when I was an undergraduate student at the University of Connecticut. And I am a firm believer in the power of stories and storytelling. And it started even then when I read a book. It was The City of Joy, about a missionary who had done work in India, and Mother Teresa's missionary. And so after reading that book, I was so inspired. And being of Indian origin and being South Asian, obviously India was close to my heart, but didn't know anybody in the city of Calcutta, and thought, well, what if I could get a few of my friends together and we could travel across the world and work in Mother Teresa's missionary? And, you know, you can imagine this is long before the internet. So all we had was an address on a page in the back of a book. And there were 5 of us. We raised some money, and we headed to India, and we literally landed in Calcutta, India, and knocked on Mother Teresa's door. She was still alive back then. So this was in 1990 and 1992, and knocked on her door, and we said, we're here to work for the summer. And I spent 3 months working in Mother Teresa's missionary for the dying and destitute. And I worked with women with tuberculosis, leprosy, you know, other chronic and infectious diseases. And what really struck me, and this is, you know, we're talking 1992, this is before people really understood what public health was. This is, I think, when there were less than 20 or 25 schools of public health, you know, in the country. And so I didn't know much about public health either. And what I learned through that experience was how so many of the women ended up in our center for the dying and destitute, not simply because of the health issues they were facing and because they needed treatment, but the root causes of gender inequity and poverty and the social context in which they had been living. And that is what brought them to sort of the Center for the Dying and Destitute, really the poorest of the poor, with no access to any social support or health care. And that really sort of catalyzed in so many ways, my thinking about, well, yes, we can treat an individual, but what if we can really address all of these root causes and think about health at the population level? And again, at that time, I didn't know that was what was called public health. So when I came back, I, learned all about public health. I learned about schools of public health, and then found myself at Johns Hopkins, where I studied in the Department of Population and Family Health Sciences in the Bloomberg School of Public Health, and really has focused my entire career on addressing the health and well-being, particularly of adolescent girls and women. That's really just the beginning. But that, I will say, like, I carry that experience with me even today, decades later, and really always trying to remember the women's stories, the stories that I heard, and really keeping that at the center of the work that I do day in and day out.
Wonderful. Before I dive into the second question, I want to share, very excitedly with the audience that this is a very special podcast for me, because Dr. Vyas is my graduate school thesis advisor, where I evaluated a pilot among 3 middle schools in when it comes to the Girl Rising curriculum, which I'm sure Dr. Vyas will talk about, in the interview. I don't want to give too much away and steal her thunder, but as we continue to learn about your incredible journey, we want to learn about how did you become involved with SAPHA, and what sparked again, you already shared a little bit about your interest in South Asian public health, but how did you catalyze that interest into your involvement with SAPHA?
Well, big shout out to Anita, to everyone who's listening on this podcast, because she was a stellar student, and it was an award-winning thesis that she had done on our Girl Rising work, which I will happily share with all of you later. Gosh, when I think about SAPHA, it brings up some of my best memories in terms of my journey in public health. A young graduate student with other graduate students. I was at Hopkins. There were other students in Baltimore, at other universities. And we, as many South Asians do, we tend to find each other and connect. And we just started the most organic conversations in Baltimore back then around wanting to feel represented in our work, going to class day in and day out, reading research studies, looking at what advocacy efforts were happening, in Baltimore, in Washington, D.C., across the globe, and realizing, where were the South Asians and where was our representation? And again, it was a time when South Asians were starting to really join the field, of public health. And when we first started, I mean, we'd be at like a Barnes and Noble in Maryland, sitting on the floor, brainstorming ideas. And one of the first events we did, I believe it was in the 1990s, I think the late 90s, was an advocacy event focused on HIV/AIDS in India. And it was, let's call attention to this pandemic. Let's call attention specifically to India. And how do we really mobilize advocacy efforts and resources? And we were able to mobilize the South Asian community in sort of the DC metropolitan region. We were able to partner with congressional offices. And we hosted what I think at that time was probably the first and largest event that had ever been hosted on Capitol Hill for South Asians. And it was sort of after that, again, that we started growing and really building the community that we thought, okay, well, there's a growing population of South Asians in the US. Where is that research happening? Where is that advocacy, happening? And that was really the impetus for the Brown paper. And I have to tell you that over the last 20 years, I've moved homes many times, and I still have a box of the, actual publication of the Brown paper that has moved with me. And I can't seem to get rid of it because it holds such a special place in my heart. And it's been incredible to see new South Asian leaders sort of join SAPHA and update what we called the brown paper back then, and continue to update that work. And so, I think it's, we all want to feel connected to our work. And I think public health in so many ways, it is a career, but it's also a call to service. And so we want to feel connected to the work, and we want to feel represented in our work. And who better to sort of be the voice of the health and well-being of South Asians and South Asians themselves.
It's amazing. Thank you so much for that. And you kind of got into this a little bit, but I wanted to know, how has your experience with SAPHA sort of influenced your career trajectory or personal growth in the field of public health, to the point where you're at now?
Absolutely. The beginnings of SAPHA and the work that we were doing really required a lot of advocacy efforts. And so even though I was at that time pursuing my doctoral degree, which is very research focused, because of the work we were doing with SAPHA and the need to call attention to why it's important that we address the health of South Asians living in the US and South Asians in other countries as well, I really got sort of a first taste of what advocacy really looks like. And in so many ways, that stayed with me throughout all of my work. All of my work that's focused on adolescent girls, maternal and child health, women's reproductive health, it's not ever solely been research for the sake of doing research or just answering an important question, but it's really been driven by what kind of research can I do? What kinds of programs can I design and test through rigorous research that's really going to help others in the advocacy work that they're doing, to call attention to the important issues that women and girls are facing everywhere, everything from girls' education to reproductive health to maternal and child health and nutrition. And, I think that work with SAPHA always stayed with me, and has, again, it continues to be really an important spirit almost behind all of the research that I do.
Wonderful. Absolutely. Dr. Vyas, undoubtedly, I consider you one of my mentors, and I think that it's mentors play an incredible role in shaping the lives and the careers of public health professionals and other professionals as well. So we're really interested in hearing. Can you talk a little bit about your mentors or role models who've influenced your career in South Asian public health, and what are some of the lessons that they've imparted to you and you've learned from them?
Yeah, that's such a good question. I've been lucky to have lots of mentors along the way. And I think that the thing that's so important to remember is that mentors come in all shapes and sizes, right? And so they're not always the most senior person in the room, right? I think of mentors as guides and people who constantly are teaching me. And that I have, Anita, just thinking about you, Anita, I learned so much from you as a student, right? I learn from my students every day when they bring sort of their whole self into the classroom, into the work that they're doing with me, into being on my research teams. And so in so many ways, I've been mentored by my students. And I feel incredibly lucky to have that experience. I have some incredible colleagues that I've worked with at George Washington University in our maternal and child health program. They're colleagues and friends, and I learn from them, every day. I will say that the dean of our school at George Washington University has also been a mentor of mine. I worked closely with her through the COVID-19 pandemic, where we were standing up initiatives early on in the pandemic, both at the university, but also around the District of Columbia and neighboring counties. And she's somebody that I have always looked up to. And when I think back again to those early days of SAPHA, there were everybody who was part of it, Abhijit and Ushma and Ketan, Sharmila, everybody, I feel like they've all played a role in terms of providing some learning and mentorship to me. And again, I still keep that with me today.
That is amazing. Yes, I can't emphasize enough, as someone that's at the mid-career stage, how critical mentorship is, not just mentorship, but having an advocate, I think is just one of the things that I really have grown to appreciate. And now, I've had the chance to sort of, return, pay it forward. And so I really appreciate that answer. So Dr. Vyas, you've been recognized with several awards for your teaching and mentorship, including the George Washington University Bender Teaching Award and the Student Supervisor of the Year Award. What specific principles would you say guide your approach to mentoring public health students? And how do you foster their professional growth and development?
Yeah, that's a good question. It's always a hard question because everybody's different and sort of the type of mentorship everyone needs is slightly different. I think the best mentoring relationships on both sides is when both people bring their authentic selves to that place, to that relationship. And so one of the things that I always try to instill or to convey to my students and those who work, junior faculty and doctoral students and, others in the community when I'm working with them is how can you build your confidence? How do you find what is your strength, right? That you shouldn't try to be somebody else, right? Everybody has their different strengths. And the key is to find what is your strength and to build upon those strengths. And at the same time, not to be afraid to take risks, right? I mean, one of the things that I think I always try to bring to mentoring relationships is to say, go ahead and take that risk. I'm here to catch you if you fall. And to share our failures. I think oftentimes, as you did earlier, you read my bio and it sounded great. Even I was listening and I thought, wow, that sounds really fantastic. But along that journey has been so many failures, so many more failures than even successes, right? And I think that you have to show up as your authentic self, and you have to also be vulnerable in some ways to share with those who you are mentoring. Again, whether it's in the classroom or whether it's one-on-one relationships with mentees, you need to be able to share your own failures. And I do think that that's an important piece of what I bring to mentorship, is that authenticity, the ability to build people's confidence, to find your strength, and to not be afraid to fail and to not be afraid to share my own failures. I think the other thing, and I find this, especially for people who choose public health as a career, again, it is so much around of who we are and our identity, and it's not just a job. And so you have to bring your whole self to any mentoring relationship, right? You have to bring your personal self, you have to bring mind, body, spirit, and it's your professional life. And I think if I can bring that, again, into the classroom and into those mentoring relationships, then other people will bring that as well. And that's when I think you really find that those relationships flourish and blossom and everybody learns.
Yeah, absolutely. I think that, my mentors, including you, Dr. Vyas, have been, very critical in kind of imparting that lesson, because, I think of schools as laboratories where you should be allowed to experiment and try and fail. And because mistakes teach you some of the best lessons. And so speaking of lessons, what is the biggest lesson that you've learned in your career? You've already shared some of them with us, through your journey and as your role, both as a mentee and as a mentor. And what is the one thing, and it's always going to be hard to pick one thing, but we're going to ask you to try. What is the one thing that you wish you knew 25 years ago when you were, sitting in that floor of Barnes and Nobles, collecting your friends together, planning that incredible event on Capitol Hill? What was the one thing that you wish you knew back then that you'd like the current and future public health professionals to know as they're building their careers?
Yeah, really good question. Well, I don't know if it's hard to find one word to answer here, but I will say it's the power of trust and happiness. I think those are the two things. If you can't build trust with people, then you can't succeed. You can't have the impact, that meaningful impact that you want to have. And I think it's a lesson that's taken me a long time to learn in so many ways, because we're often really impatient, right? We want to solve. We go into public health because we see a problem that needs a solution and we want to solve, right? We want to find that solution, and we want to have meaningful impact. We want to transform the world for the better, right? But before you can do that, you need to build trust, because you can't do it alone. So you need to build trust in your teams. You need to build trust with communities. You need to build trust with everybody that you're interacting with before you can actually even begin to start thinking about what the solutions are. So that's one thing. And then the other thing is sort of that I've become more interested in, which is the science of happiness, right? That if we can build flourishing, happy individuals and communities, right, we will together be able to solve many more problems. When I think about, I'd be remiss not to talk about, what's happening today on college campuses. As we are talking today, what's happening across the country on college campuses, the fear, the anger. And so how do we as public health professionals really start teaching people the science of happiness and well-being and things that we can practice in our everyday lives? Because I do think eventually that will change the discourse. It will change our ability to have really honest and difficult conversations, and it will build trust, right? And so if we can do that, I think it will really help to alleviate what I see as a lot of anger and fear on college campuses today.
Great. And now, I really want to, and you've already kind of alluded to a little bit of this, but let's rewind time a little bit and take a journey down memory lane. Is there anything that in particular that you enjoyed the most during your time with SAPHA, whether it was one particular moment, the process? What do you think stands out the most in terms of what you enjoyed during your time at SAPHA, especially building the foundation for where we are today?
Wow, so many good memories and hard ones. It was a difficult journey in those early days, right? Like this is before everybody had like a nonprofit organization. We were one of the first even South Asian nonprofits. And to think about, well, do we have a lawyer? Is there somebody, which we did, we found somebody, right, who could help us think through our 501c3 status and how do we sort of market who we are? This is pre-social media, right? I mean, how do you get the word out there to people across the country that, look, we're a group of, South Asian professionals. I will say, I'll go back to, so it wasn't an easy journey. I think it had a lot of challenges because, which is often the case when people are starting something new. But I will say, my favorite sort of groups of memories is really around the building of community. To be a part of something where, as we started talking to those about what we were doing and our vision for SAPHA, how many people started joining the community of South Asian public health professionals, and how energized and committed people were and people continue to be today. So I think when I think back to that, it was every time we gathered as a community, and again, this is pre-Zoom, right? Like we either had conference calls. I don't even know how we did it back then, but we had some method of some 1-800 number we called, right? Or actually sitting on the floor of Barnes and Noble and trying to think through what's the vision for this organization. So some of those really hard conversations are some of my favorite memories.
Over the past 25 years, speaking of memories, SAPHA has achieved significant milestones. And so you're probably very much aware of them. So indulge me as we go down the memory lane, because, I want, to share some of these memories also with and milestones with our listeners. Over the last 25 years, SAPHA has achieved significant milestones, of which Dr. Vyas has played a very important role, including obtaining 501c3 status, thanks to the lawyer they were able to contact, publishing influential research like a Brown paper, The Health of the South Asians in the US, which you were the editor of the very first issue. And thank you for carrying that one extra box with you through the various homes you've moved into, and receiving prestigious awards, forming critical partnerships, advocating for health equity, and actively addressing the evolving health needs within South Asian communities. The impact of SAPHA has extended to legislative advocacy, such as advocating for South Asian Heart Health Awareness and Research Act, participating in national health campaigns, and establishing a noteworthy presence in Washington, D.C., marked by engagements with Secretary of Health, invitations to the White House, active participation in key conferences, and continuous efforts to address health disparities and promote health equity in South Asian communities. Again, this all started because of a very strong and earnest and foundation laid forth by South Asian professionals, including our very own Dr. Vyas. So given all of this, Dr. Vyas, and again, just very small question for you to answer. Where do you think SAPHA can be most impactful in the next 25 years?
Yeah, I'll go back to that concept of building community. I think that is like where SAPHA can be highly influential. Like bring back, everybody who's been part of SAPHA for the last 25 years, and then look ahead to the next generation, right? I mean, if we look across college campuses today, the number of South Asians on those campuses, right? And many of whom are looking to public health, they're looking to make a difference in the world. They're looking to make a difference in their own communities. How do we gather all of that new and young energy and enthusiasm for SAPHA? So I think it's really about building community and kind of connecting the generations and decades, right? Like 25 years later, again, like going back and bringing all of the sort of more senior people, but also looking ahead and bringing in all of this new young energy. I mean, I see it all the time with young undergraduates who come and reach out to me, and even young graduate students. I mean, there's so much excitement, enthusiasm around South Asian public health. And so how do we continue to grow and build that community? And I think if we can do that and do it thoughtfully, then, all of the successes that SAPHA has had, I see that continuing to grow in big ways. Again, whether it's national advocacy, global advocacy, and advocacy at the state level.
Great. So I have to confess, when I saw your name and learned about who you were, I was very excited. As a current MCH professional for over 12 years now. Kind of just fell into MCH, was just trying to get a job and ended up in MCH, and I've been here for 12 years. Can't imagine doing anything else. And as the director of the George Washington Center of Excellence in Maternal Child Health, also a great feeding path into MCH work across the country. What are some of the key initiatives or programs that the center is currently undertaking to address maternal and child health disparities, both domestically and globally?
Yeah, thank you for that question. It's near and dear to my heart. I have the privilege of being the director for our Center of Excellence in Maternal and Child Health, but I represent a really large team of faculty, staff, and students who really make my job so incredible, because I get to sort of talk about all of the wonderful work that we, the collective we that we're doing. So a lot of the work that we're focused on, it sort of falls into a few areas. One is training. And so as a Center of Excellence in Maternal and Child Health, we have sort of enhanced training programs for our maternal and child health MPH students. So we provide extra leadership training and workshops. We really bridge together practice and policy. We provide sort of, different training, experiential training opportunities for our students. In terms of research, we're really focused right now around maternal health and youth mental health. Those are sort of the two key areas. So in the district, as you know, we have one of the worst maternal death rates in the United States, right here in our nation's capital. And so we've spent time over the last 3 years sort of doing a comprehensive study and assessment around, what's driving a lot of these health disparities around maternal health, everything from structural racism and, inequities in the health system, access to prenatal care, postpartum health and mental health, the increase of chronic disease. And so one of the things as we look ahead now to sort of the next maybe several years is sort of taking all of this research that we've done in the district and thinking about the design of new interventions that are perhaps more innovative and able to address some of these issues that we know are really driving maternal health disparities in the district. So that's a big piece of it. Part of our work has also been focused on South Asian American women. So our center actually funded one of my colleagues and former SAPHA board members, Dr. Natasha Nagraj, to lead a study around South Asian American women's health. So looking at sort of the intersection of chronic disease and experiences with violence. We're now going to start looking at things. We've got sort of tons of data. We're looking at fertility and other reproductive health issues. We're looking at things like gestational diabetes among South Asian women. So really the center, is focused both on maternal health, particularly among women of color in the district. We're focused on South Asian American health, and some of our colleagues are focused on youth mental health and are developing new interventions with our community partners in the district focused on youth mental health. And then for me, globally, a lot of my work, as Anita knows, is really centered around adolescent girls and women. And so, in 2014, I was becoming incredibly frustrated with how many of the adolescent and women's health interventions that we were implementing and testing on the ground in places like India had short-term impact, but rarely did it have sustained and long-term impact. And it had just become incredibly clear to so many of us that unless we can really address the root causes around gender equity, right, that these incredible programs and interventions on the ground would not be able to flourish in the way that we would want them to flourish and have the impact that we know that they could have, right, if we couldn't really address this issue of how do we value adolescent girls and women in India. And so I had the great fortune at that time of joining Girl Rising as a producer and launching our Girl Rising India film and campaign. It was a national campaign in India. And really at the heart of this campaign was, how do we create a new normal? How do we change how people across India value girls enough to educate them, to ensure that they're healthy and to have a prosperous future? And so if we can change the hearts and minds of people through storytelling, then that would be sort of a gap, that is a gap and a critical place where we could really help enhance all of the efforts that were happening on the ground around health and well-being for girls and women. So, that's a little bit about sort of the center and the work that I've been doing with Girl Rising for several years now.
So like I said to the learners before, I didn't want to steal the thunder. And this is why I had the privilege of being part of, just a very small part in evaluating the pilot, pilots of the middle school Girl Rising curriculum in 3 schools in middle school. And again, I highly encourage all of you to learn more about Girl Rising curriculum. The film is still very much fresh in my mind. It's incredibly inspirational. Thank you, Dr. Vyas. I'm sure you'll touch a little bit more into it as we go along. I mean, you've mentioned your work in the district, you've mentioned your work in India, you've mentioned your work in collaboration with South Asian health professionals across the country. Again, clearly your work spans across local, national, and global levels. So, and you've talked about the incredible successes and the progresses, but how did you navigate the challenges of implementing public health interventions in these diverse cultural and socioeconomic contexts, whether it's the wards in Washington, D.C., or whether it's, remote places and places, in India, especially concerning issues like women's health and violence prevention and other equity issues that you were trying to get to the root of?
Really good question. And let me just say, there's no small part to the work that we did at Girl Rising. It was 100% a team effort. And so everybody's contribution is what today, so many years, almost 10 years later, we are now in, 14 countries across the globe doing this evidence-based work with adolescent girls and boys. So really good question that you asked, because I've worked in so many different contexts and very different contexts, right? And it goes back, I think, to what I was talking about earlier. Two things: centering the voices of women and their stories has always been critical to my work. Some of my favorite and most transformational memories as a person and as a public health professional has been when I have sat on the floor with women and listened to their stories, whether it was commercial sex workers in a brothel in Bombay, whether it was women living with HIV in a township in South Africa, whether it's with women right here in the district. Centering their voices and meeting them where they are and listening to their stories and really listening. I think, the key for us as public health professionals is to build our skills and to be able to adapt those skills to whatever the public health issue is of our time today. And, not everybody agrees with that. I think lots of people might debate me on that. People think, no, you have to create depth in one area. That's how you become an expert in that area. And I'm certainly not saying you shouldn't have expertise. But what I'm saying is that I think that it's important that we build skills and be open to adapting those skills to what today's issues are. And the way to understand what today's issues are is, again, by centering the voices of women in the work that I do, at least. And so, yeah, I mean, I think, again, whether you're working right here in Washington, D.C., or you're working in another country, it's a different place. It's a different community. And the issues that are driving sort of whether it's maternal health or women's health, it's different. And it goes back to the trust and building that trust and collaboration, right? You have to have the patience to be able to take the time to build that before you can actually start solving some of these problems.
Thank you. And just a quick follow-up. And I think one of the things that drives people forward and researchers in it, because we're in it for the long haul, we're in it for, as public health professionals. Can you talk about, what changes you've seen over the last, how has it evolved in the last 10 years, say, even if you're taking, Girl Rising and in the last 10 years, and how do you see it changing in the future in terms of the journey that you've witnessed so far?
Yeah, good question. So the good news is we've made a lot of strides around things like girls' education, right? So like in 2015, when we launched Girl Rising in India, and when Girl Rising launched globally in 2014, global girls' education was actually not on the global agenda. Everybody wasn't talking about it. And, not to say that this one film is the reason everybody was talking about it, but it certainly was part of the landscape of what was happening in that moment in time. And so where we are today, we're in a much better place. My work is really in this area has focused a lot in India. More girls are being educated than ever. More girls are making it past secondary school. More girls are going into higher education. And now this is sort of where I'm pivoting a little bit my own work. But we don't see those great successes translating into more women in the formal economy, in the workforce in India. Less than 19% of women in India are in the formal workforce. So if you think about the incredible strides we have made, they're still holding women back. There's something still holding women. There are lots of things holding women back, actually, I should say. And so again, we need to get at some of the root causes of that. And I think, I often talk about that we need to take sort of a life course approach to addressing so many of these issues. Everyone loves to talk about, we want women to be economically empowered, right? It's about women's economic empowerment. Well, that's great, but starting when a woman is 30 is probably not enough, right? Again, it goes back to the moment an adolescent girl becomes an adolescent, her life becomes dangerous, right? She's at risk of early marriage and early childbearing. We know the risks associated with that, the risks associated with then gender-based violence, right? I mean, and so it continues on and on and on, right? Does she have the power to decide how many children does she want to have? Does she have access to family planning? More than 60% of women are anemic in India. You know, how can we expect women to go to work every day when they're anemic, right? It's billions of dollars and in lost in cost. So just thinking about sort of, we have to do two things. We have to take a life course approach. We have to start early, right? And building all of these things for women. And we have to think of a woman as her whole self, right? I often say if women are not healthy, educated, and free from violence, they absolutely cannot participate in the formal economy, right? If you're not safe at home, you're not safe on the way to work and safe at work, right? Why would you stay working, right? And so, you know, we have to think about sort of all of these issues comprehensively. And I think for so long, we've all been working in silos, right? You've got the family planning people here, even maternal and child health and family planning, right? Different silos, right? We've got people working in training and skilling. We've got people working in financial inclusion, access to digital technology. We have the gender-based violence people. They're another group of people, right? And so how is it that we can actually come together to understand comprehensively in sort of this life course plus 360 approach, what are all of the needs that adolescent girls and women have? And how do we intervene across all of these sectors to provide those, you know, the interventions that she needs? And I think until we can do that and kind of really take this paradigm shift and reframe women's health in this context, we're not going to have that long-term sustained impact. And I do think, going back to Girl Rising, and I continue to believe that storytelling plays a really key role in changing the hearts and minds of people, and it plays a key role in advocacy efforts, which, you know, allows us to unlock and unleash resources that we wouldn't otherwise have to invest in girls and women. So, you know, that's sort of where my journey has been, and now where I'm looking ahead to the work that I want to do, really focused on sort of taking this more comprehensive approach.
Wow, that, you know, this is cool with Dr. Vyas. I mean, I'm inspired. It's wonderful. It's going back to grad school. Thank you so much for that, Dr. Vyas. I appreciate that. But just you know, as second last question. I mean, we could keep talking to you forever, but you know, you talked about this incredible need for life course approach and building trust and communication and the amount of resource it's going to need. We're going to need to marshal to get the various professionals to not work in silos and communicate with each other to continue making progress for women and girls and boys across the globe. But, you know, as you very well know, having worked with the Dean of School of Public Health during the pandemic and even before and after that, public health had been somewhat in the background for many years, and people didn't know what it was, and people didn't know how to define it. And then, of course, again with the pandemic, it was suddenly in the limelight. And since then, the public health community has faced a lot of challenges, and perhaps even before. But it was, you know, the light was shown upon the public health community, especially during the pandemic, including burnout and significant spending cuts. The state and local health departments were particularly talking about, you know, US as a context here, but it's true globally as well. Mistrust in public health agencies, and more recently, we've seen people try to push back against work to address systemic inequities, systemic barriers, and push back against DEI and push back against people who are trying to address the root cause of issues. Given all of this, again, a very question for you to address. What advice do you have to keep the next generation of public health professionals motivated, and for them to keep going, and for them to keep doing what they're doing, and keep hope in the impact of public health work?
Yeah, that's a big one, right? I mean, COVID-19 really shined a light on all of the gaps and weaknesses in the public health system in this country and around the world, right? You know, whether it was like, I still remember early in the days of the pandemic, where we were training our students to go work in health departments to do case investigations and contact tracing. And we were getting, you know, lab tests, we were getting COVID-19 results through fax machines, right? I mean, doesn't that just blow your mind in 2020? And that's how they would come. Fax, you know, faxes coming across counties, into the district, out of the district. And, you know, it just shined a light on how poorly resourced our public health systems are and how important they are, right? Like, we need to be ready for the next pandemic. So, and we're continuing to live with the aftermath. I mean, I think burnout among healthcare professionals was always there, but it's certainly, you know, it was exacerbated through the pandemic. I think if we think about young people today and the explosion of social media, we were likely always going to get to where we are today with the youth mental health crisis that we're facing, crisis of loneliness, social isolation, anxiety and depression. But again, the pandemic just accelerated it, right? So the pandemic really accelerated lots of things that were already happening, and we could see were happening. And now we're sort of left with, okay, how do we as a public health community deal with this aftermath? And two words, happiness and optimism, is sort of, you know, going back to the science of happiness. I think we have to build, I'll add one more word, resilient. We need to build a resilient and happy workforce, right? Because it's never going to be easy. You know, I don't think we can lie to people and say, oh, you're going to be happy every day and this work is going to bring you joy every day, because that's just not the reality of the work that we do. It's hard work, you know, and it's not always highly compensated work. It's not always highly valued work. It's work where you need interdisciplinary teams and not everybody gets the limelight. You know, it's hard work, but it's meaningful work. And so I think if we can help build resilience in our public health workforce, I think that's really important. I think that resilience is connected with people's happiness. And so for people to understand the science of happiness and what are the tools that they can use, because what drives your happiness might be different than what drives mine, right? And so how do we use this evidence base and this science to build our own resiliency and happiness? But then also optimism. You know, we are faced with a world now with so much misinformation and disinformation and continued cuts to public health, right? And an unknown future in terms of the climate that we are in today and what we might be in a year. But we can't give up and we have to be optimistic. And sometimes that optimism is unwarranted because it's so hard and because the challenges are so great, but we've got to keep up with that optimism. You know, we're still dealing with issues like maternal health. I mean, it is shameful in my mind that a woman in this country dies during childbirth or in the first year after giving birth. Shameful, right? And so we can't give up. We have to have optimism. We have to remember that not every public health issue is sparkly and sexy. Some of the issues we're facing are issues we've always been facing, but we need new energy, new solutions, and new innovations, and we can't give up.
Very well said, Dr. Vyas. Our last question for today, and you've gotten into this already a little bit, but any closing pearls of wisdom for those aspiring to do work in South Asian public health, besides coming to talk to you?
I think that, you know, as I think specifically for South Asians, it is to be your authentic self and to bring your whole self to the work that you're doing. And I think oftentimes, you know, we talked about it in the Brown paper and in the Brown paper 2.0 and all of the other sort of white papers and reports that SAPHA has put out, you know, this concept of the model minority myth. And a part of that is sometimes, you know, historically South Asians not using their voice and not always being, you know, causing a little bit of trouble. And you know what? It's okay for us to do that. You know, we have an important role to ensure that people don't forget about South Asians. both here in the US and around the world. And so I think it really is incumbent on us to use that voice to really to raise and to rise up around so many of these issues. And so what I would say is, shed that fear and bring your whole authentic South Asian self to the work that you do every day.
Love it. Gotta say, yeah, authenticity and then making it personal, absolutely critical. Thank you so much.
Absolutely. Well, I cannot thank you enough, Dr. Vyas, for taking us on this incredible journey through your experiences and insights. And for viewers, we will absolutely link Dr. Vyas's work, Center for Excellence in Maternal and Child Health at GW Milken Institute School of Public Health, her work in Global India Fund and with Girl Rising, etc. It's been an honor to have you, especially for me, as our guest on the SAPHA Spotlight series. And with that, Amish, I'll turn it over to you.
Yes, ditto. Can't say enough about learning about you. I feel like I've been more inspired and re-inspired, and all the superlatives. To our listeners, thank you for joining us on this milestone episode. Stay tuned for more conversations with past SAPHA board members as we continue to explore the career progress of individuals who have paved the way for change within the dynamic world of South Asian public health. Follow us on YouTube and Spotify by subscribing to our channel. If you enjoyed this episode, please consider donating to SAPHA at www.sapha.org. Until next time, this is Amish and Anita signing off.